Hi, I'm Rhonda Andrews. I am the administrator for the health department, and I'm also a hospice volunteer. I've been a hospice volunteer since 2009, and one of the roles of a hospice volunteer is to go out to the home, whether that be the long-term care center or to the patient's actual home, and go out and visit with them, provide them with encouragement, provide them with a listening ear, or sometimes read to them. Sometimes we have a music therapy program. So just basically to give them some comfort and some kindness towards the end of life. A lot of people will ask me with the health department, what does hospice do, or what does hospice mean? Hospice to us isn't just a program, it's a philosophy. It's about not only with other health department programs, we teach people the way to live, we also try to help people whenever it's time to die. We do birthing programs here at the health department, and we have doulas that will go out and assist people to give birth in the home. So it also seems appropriate to us that people could also die in their home. A lot of times with hospitals, it's a really clinical setting. You have doctors standing around, tubes are going everywhere, there are alarms going off. But when you're in your home, it's more of a comfortable setting. You're surrounded by people that you love, your favorite objects, your books, whatever it might be that you love. And pets, whatever. So it's a lot more personal, it's a lot more private. I know in a lot of cases we've had people that have signed up for hospice. Our nurses have came in, taken such good care of the clients that they've actually become better and have been discharged. Now that doesn't always happen. I can't even say that it frequently happens, but it has happened. They get really good care, they get personal hygiene care, they get nursing care that they wouldn't have gotten otherwise. So we're very proud of our program, and like I said, it's a very personal thing.
I'm Dr. Ryan. I am the medical director for Fayette County Hospice. My role is to supervise the medical care of our hospice patients, to help with medication management. I also have to make face-to-face visits with the patients in order to keep them certified and to follow Medicare guidelines and regulations. And of course, I participate in the meetings as well.
As the director, I direct the program. I assess new patients, assess their needs, prepare the care plan for the physician, orchestrate the team members to visit the patients, coordinate the bereavement, the volunteer program, and also conduct a lot of community projects.
Hospice has really given me a different perspective on how we care for patients. In medical school, they teach us how to save everybody. They don't really teach us how to help people at the end of life. And there are so many situations that I see in my line of work where people do everything and take extraordinary measures when cases are futile. And I think we need to offer people palliative care and non-aggressive care at the end of life, and we don't do a very good job of doing that. And being the hospice director has really given me that perspective and that insight, and it has really changed the way that I take care of patients.
I'm Sherry, and I go into the home and wherever their home might be, and I like to provide personal care for them.
Hi, I'm Dr. Melanie Schaffsma, and I'm a social worker for hospice in Fayette County. One of the things that I do is I always go and visit every patient assigned to me, and I do an overall social assessment and get to know the patient and their family.
So I explained to them that your mother was at long-term care for 9 months or something like that, and just didn't like it at all. And so you chose to take Mom home, to care for her at home, which I truly admire. There are a couple different areas that we focus on, and of course pain and palliation, which is comfort, and her skin status and things like that we're very concerned about. Your mom has been under our care now for a couple of months, and how do you feel everything is going with hospice?
I think it's all going good, really. She seems happy and content that you're coming in, and she looks forward to that. She does, yes.
You know, sometimes that happens too.
Right.
You know, with all the team coming in, it's a little overwhelming.
I was worried it would be, but she was she was really happy, really, to have more people come in and see her.
Okay.
She seems, like I said, she looks forward to the visits, because I was there one day, I think right before they got there, and she was like, well, I wonder when they're coming, And she was real, and I didn't know she was going to be that way at first, because she's not one to like people to help her.
Okay, all right.
But she seems to be doing good with it.
All right, so this is the update for our meeting, and I'm going to have you, if you can all three sign it there.
And you just do this every month, you said?
We have our meetings every month, but we schedule different patients for different
okay.
months. So, there's no way that we can see all of our patients.
Okay.
What'd you say, John? You wanted to come back next month?
Yeah.
Is that what you said?